DIA Munich, we have startups on steroids. You know, in a few 2 years, you have 200 people, $80 million of investment, and you make a system where people can be connected through a telemedicine system. That's amazing. And the company is called Cry, right?
Not quite. We're called Kry, which is a Swedish word for healthy and well.
Yeah, but you say K-R-Y, so it's a great name to basically be everywhere. So in 2015, you started the company, and there were 4 people who were frustrated about the way they received healthcare. What was their frustration, and what have they built?
So they were wondering that they can do pretty much everything in their life via their smartphone. But if they're sick and when they need the most help, they didn't have access to a doctor quickly and efficiently. So they were wondering, why can't I just see a doctor over my smartphone? And that's how they founded Kry. They built a video platform. We're working with 400 doctors now in Sweden and are supplying a lot of primary healthcare to all the Swedish population and also in quite a few other European countries already.
And how many sessions have you done? How many consults have you done?
We have helped more than 500,000 patients already.
Okay, in the last 2.5 years, and mostly, of course, it's accelerating. You're now going to, so it's hundreds of thousands of people per year, and the company is also very well funded, right? I mean, you raised 80 million by who? Which are the partners there?
So our main investors are Index Ventures and Excel, and we also have Project A from Germany and Cristina from Sweden.
Start in Sweden. Which other European countries are you active now?
So we're also active in Norway, and this year we have launched our service in the UK and in France, and are now preparing to also launch in Germany.
Yeah. And you're not about like Uber a doctor. You have the doctors really. They are in your. They work for you. You pay them by the hours, and you have them in between small and large amount of hours. So it's really a complete integrated service which you provide, not only the tech but also the services.
Exactly. So we are a tech-driven healthcare provider, and our objective is to help patients. And in order to do that, we work very closely with our doctors. We have very high quality standards, and we educate and select our doctors in a very well-developed process.
Yeah. And you have a little bit of scale. And now, who's paying for it?
So essentially, either we are in the public system, then it's the public system paying it, or we work with insurances.
Yeah. And do you get paid the same amount of money as if I visit a physical doctor? Is that what you're trying to get, or how is that working out in Sweden to start with?
So essentially, like when a patient sees a doctor in Sweden via the public system, it's just the same as having a meeting in the public system. And if I'm, as a patient, seeing a doctor through an insurance company, I'm not paying anything, but the insurance is paying.
But it's the same amount. It doesn't matter if you use your platform or if I go physically to a doctor.
Exactly, that's the.
In Holland, we pay if you do email consult or you do a phone consult, you only get paid half. But would that be enough for you to supply the service?
So we are providing the same service over video as you're providing over in a physical environment, because we can write prescriptions, we can give you a diagnosis, we can refer you to a specialist. So it's the same service, which is reimbursed on the same level.
A lot of countries have in their law that that the doctor has to physically see the patient. Physically see the patient. Does that include video? Is that accepted by the law systems in the countries where you work?
That's very different in each country, and we are operating locally in all the markets that we are going to. So we actually look very closely at each of the healthcare systems and establish ourselves in a way that fits in the local healthcare systems. So and that's different. And like in Germany, for example, we're just seeing a very positive change in that regard. So we're very, very positive.
What is the positive change?
So the physicians in Germany have decided that it's actually okay to establish a diagnosis remotely now.
If the Germans accept it, that means that the rest of Europe is not far behind. Now, what is the experience after hundreds of thousands of video consults? About the quality, about the repeat, about the mistakes? I mean, tell us about the result.
So we have very, very good patient experiences. Patients are very happy. They are coming back. They're giving us high ratings. We actually ask after each consultation the patient to give us feedback on like how his consultation has been, and that we use in order to learn and constantly improve our quality. And that you can tell, because like by doing that we can tweak our systems, we can tweak how our doctors interact with the patients. So patients are very happy and they come back with their kids, they come back with their parents. And so this is also a service that is not that is like adopted by a broad range of the population.
Okay, of course, because you're totally digital and mobile, do I have access to the patient records which the doctor has filled in so that I can basically review if what he wrote down makes any sense?
Right now, the doctors can see what other doctors have written, and they can access central files if they are available in the systems.
Can I, as a patient, see those records?
Right now, you cannot see the details of the records, but that is like also depends on like local regulations, of course.
The local regulations says that the medical information is mine. I can go to a hospital and get the information. It's a pain, but you can do it, and it's law everywhere in Europe. But now you have an opportunity to make it extremely easy to basically see what the doctor writes down. Why isn't that the case yet?
Well, you're up to something, and we are, of course, thinking beyond what we're doing today.
Yeah. It is a problem because doctors write things in these notes which are not for public consumption most of the time. It's really a problem. They have to think, hey, the patient might see that, and they have to think about it a little bit more. So it's really an interesting problem. At DIA, what kind of companies are you looking for? Who's interested? Who do you want to work with, and what kind of partners are you looking for?
Well, we're looking to talk to insurance companies who want to offer credit to their policyholders in order to provide them quick access, good access to care, to differentiate maybe from other players in the market, so we're happy to talk to health insurance.
But you want to talk to insurance companies which want to pay for it, but you want to put it into the market in that country, not as a white label, but as a CRI labeled service.
We are not doing white label, but we are pretty good at actually co-branding with insurance companies. So we create like a customized and localized space for the policyholders of a specific insurance.
Okay. Are you doing elementary care, or are you doing more services?
So we're currently focused on primary care, but are of course expanding that also as like more diagnostics that are possible remotely become available.
And which one is the first one to come in the innovation pipeline?
So we have actually done already a few pilots, and we have done some work on asthma. We're currently doing like a pilot on arrhythmia in Sweden. So we are working on various things.
Okay. Very interesting company, seriously funded, hundreds of thousands of consults, 400 doctors, and expanding over Europe, and available to co-brand services in your country. Enjoy DIA.